Hi, I'm Chris Cochran. I'm a caregiver and I'm the father of Christian Cochran, a cholangio patient. This is Christian Cochran's journey. And this is our family. Just like many families, we travel, we do things together, and we celebrated Christian's graduation, which is the picture on the left. Christian had a path. Christian went to college for 4 years, graduated with honors from Indiana, University of Pennsylvania. He studied abroad in Prague, India. He got a girlfriend during that time, still has that girlfriend. This picture of Christian sitting by the pool was taken 1 week prior to getting the news that he had cancer. 2 days prior to that, he helped check his sister in just below in the picture with his other sibling into the same university he attended. Christian was on a path. He graduated with international relations as a degree and a minor in theater. He knew where he wanted to go. He had been acting his whole life. He wanted to go to LA. He wanted to be famous. Christian was set to go. You can even see Christian in major motion pictures. He was set up to head to LA to change and become famous. And that was his direction and his path. We were on this journey with him. But unfortunately, we were hit just before he was going to head out with the news on Friday, August 26, 2020, that Christian had cancer. I won't forget it. I remember going with Christian. We got the blood test. We did the scans. We were asked to go to Hillman Institute. The doctors walked in. I knew something wasn't right. I remember when they told Christian, they said, take your shirt off, lean back. And you could see that Christian had a very large tumor. In fact, it was 16 centimeters on his liver. I was devastated. I almost fell over. Christian was strong. Christian said he was looking at me to protect me. And he said, how much time do I have left? No 22-year-old should say, how much time do I have left? This was our new path. The path and dreams of heading to California to be famous had changed. The path was now being diagnosed with intrahepatic cholangiocarcinoma. Christian had his biopsy on September 2nd. Christian had lost almost 40 pounds. He was labeled as a stage 4. And again, he had a 16 centimeter tumor on his left lobe with some indications in his right lobe, as well as lymph node involvement. Christian had his mutations done. He has the BAP1 mutation. And that's an ongoing thing that we continue to look at because it's important. During this process, we consulted with many places, from University of Chicago to MDA, to MSK and the NIH, and of course, Hillman. Christian started chemotherapy 1 week later because there was such urgency that we had to put a stop to this. Christian started gemcitabine and cisplatin on September 9th. He did that for 2 weeks. After 2 cycles, we decided it was best to go all in, so we added Abraxane. Christian started with Abraxane and has been on that cycle. So many things run through my head, and I imagine with any caregiver or family member, so many of these things, the envy, the guilt, the disbelief, those were the things that we were feeling at that time. We thought, what is our path? This is what it looked like to us, because it looked like it had turns and twists and ups and downs. People would tell us, they'd say, it's going to be a ride. But we never lost sight of the distance that there was somewhere we were going. We would find a path. And along that path, the first people, when you Google cholangiocarcinoma, 2 names come to mind, Melinda Bikini and Lisa Crane. They were the first 2 people that we reached out to. And these are the individuals where we had our initial contact and helped us understand what we were dealing with. See, when you look at this list, there are so many names and there's so many pictures. These are doctors. These are influencers. and they helped connect us to each one of these. This is like a pyramid, and it really helped us connect the dots. It helped us to get advice. And they are really, truly guiding lights on our path. Along that way, we've had a lot of community involvement. I mean, if you look on the left, our prayer ladies, they come to our house every Tuesday since September in rain, sleet, or snow. They are there. And we live in Pittsburgh, so the weather's not always the best. So they're always there praying. And if you just come outside of our house, sometimes you'll just see a sign. The night before Christian had his first chemotherapy, unbeknownst to us, a crowd gathered outside of our house because Christian's influence was that great. Christian even put his own touch on things. The community and the school district wanted to create a shirt for Christian. Christian didn't want like an average shirt. Christian wanted to design his own shirt. So he designed it by saying, Christian Cochran got cancer. All I got was this lousy shirt. And I got his back because he had that kind of sense of humor. You know, it was a journey of firsts for us. His first pain block, his first port, his first chemo picture, which I know many of you have, and the subsequent other chemos. His first haircut, which he wanted to do. He wanted to be in control. And believe it or not, Christian, while he was headed with this devastating disease, got his first paycheck. He got a job with a major corporation and a major job. He didn't want to stop. And he even got his COVID vaccine. Just like many families, we celebrated all our wins. We celebrated birthdays, meeting with relatives, just having trips together and making every single day count. We celebrated the holidays, gift giving, being with his siblings, going to church, all those things, just having a good time. So where are we today? As of March 15th, well, Christian's tumors have reduced across all his tumors. There's been some uptick, but overall, stability and no progression. And that's always good news. He's had strong blood work. Tumor markers have been reduced. He's healthy with limited pain, and he feels really good. As a matter of fact, when I said earlier he had lost 40 pounds, he's gained all 40 pounds back. He has a tremendous support team and advocacy, and he has truly one of the greatest and most positive attitudes you'll ever see. So now, where are we at today? A new path. There's always a new path. So the path that we're on today, Christian has been accepted into the TIL trial. Now, many of you may already know the TIL trial because of Melinda Bikini. And I'm sure Melinda will tell you she knows who Dr. Kumala, who is the director of solid tumor cell therapy program at the University of Pittsburgh. How blessed that we must be that it was right here in our backyard. It turned out to be really a great thing. So Christian stopped his last chemo on February 10th, and he has surgery upcoming March 17th for the removal of 2 to 3 lymph nodes in his chest. We're targeting his infusion in late April, and we feel positive that we're going to have great results, and so does the team at the University of Pittsburgh. So what matters? Because I think of what matters, and I think of this for any caregiver or family member. Connections matter. If I hadn't made those connections with Linda or Lisa, where would I be? They help connect me to so many. And mutations matter. We continue that process, learning more about the disease and how we are going to attack it. Seek a second, a third, and even a fourth opinion. It matters. Say yes to all opportunities. When I was asked to do this presentation, I didn't even hesitate. I said yes. I know afterwards I said, what am I thinking? I have so much on my plate, but it doesn't matter. I say yes. Work with nice people matters. Success stories matter. Look for them. Break from Google matters. Take a break. It can be too much. Hope matters. Don't let fear overtake us, even though it's there. And talking to others matters. And accepting others, help matters. And survivor stories matter. and faith matters. I like to end this by putting this in Christian's own words so he can deliver a message to you. I thank you for your time, and we keep moving forward in a positive note.
Hey there, everybody. My name's Christian, and I really appreciate you taking some time out of your day to listen to my story and the way it's affected me. And I'm sure each of you have your own unique cholangiocarcinoma story to tell. There's many ways you can take a diagnosis like this or an illness like this. I'm trying my best to stay positive every day and trying to think of ways that I can use this unfortunate aspect of my life to affect change in the future. Even though I'm dealing with all this right now, I still started a full-time job and I just applied to grad school, hoping to find ways to go to school and learn ways to take cholangiocarcinoma treatment in a global fashion, help people all around the world, because as we know, even though people like me and people like us are able to access a lot of really life-changing and interesting and fascinating treatments, it's very unfortunate to think that there are people all around the world who suffer from onset till death without ever being diagnosed or treated or something like that, especially in areas where incident rates for this disease are much higher. So just, trying to be grateful for what I've got today and thankful that you all sat here to listen to my story and thinking of ways we can keep fighting cholangiocarcinoma in more ways than one. Thank you so much and have a great day.